The symposium was officially opened by the Health Minister, accompanied by the Secretary for Health and the Secretary for the Department of Justice. This medical symposium serves as a vital platform where medical doctors, scientific researchers, and policymakers from across Papua New Guinea and beyond come together to present groundbreaking scientific papers and identify pressing health challenges and develop effective policies related to health and healthcare. Focusing primarily on trauma, Minister for Health Dr. Lino Tom highlighted the profound impacts of trauma in PNG.
Is sadly no stranger to trauma. Our trauma-related statistics are amongst some of the highest in the region and the world. Trauma is the commonest cause of death among 15 to 44 years old, our productive age group, and the leading cause of surgical death in hospitals. While the causes of trauma are well known, much more can be done to address the root causes, which we have identified one of them this morning, and the contributing factors.
Dr. Tom emphasized the need for the government to utilize data-driven approaches in forming effective health policies.
Longer practicing surgeon, I have focused on improving health outcomes at the population level through health policy and health system reforms in my role as Health Minister. My clinical experience has provided me with a strong foundation and deep understanding of the intersect between clinical practice and public health, and the importance of utilizing data for decision-making to inform policy.
He then called upon health professionals and policymakers to reflect on whether they have done enough to address the issue of trauma.
We need to ask ourselves, is there a socially supported, health-enabling environment? Are policies to mitigate the incidence of trauma in place, and are they being enforced? Is there equitable access to health services and trauma care? How are we supporting people most at risk and our vulnerable population? Do our trauma services include psychological care and treatment along with the physical management of cases? Some wounds run deep.
Dr. Tom further urged participating health professionals to view trauma through a public health lens, recognizing its widespread implications.
Opportunities to actively advocate for population-level initiatives that will create a supportive and enabling environment. Preventive strategies at community and societal levels will also benefit individuals. The consequences of trauma are severe and substantial. The chronic burden of trauma impacts well-being and encompasses both health, care and medication and indirect costs, including loss of productivity, resulting in socio-economic consequences. When I look at the health portfolio, I articulated my priorities for the health sector in my 100-day plan to Parliament. I would like to reiterate these key priorities, which are aligned with the National Health Plan. Trauma is a cross-cutting issue.
While noting the critical importance of having adequate health facilities and human resources, Dr. Tom stressed the need for a concrete effort to address these challenges head-on. Sharon Engnui, National EMTV News, Mount Hagen.